Welcome to ASCP's Our Experience podcast with your host, Tom Hansel, and your CEO extraordinaire, Chad Wurst. Today, we are talking to two gentlemen from a pharmacy that I consider a legacy pharmacy down in the South in Mississippi. This is Tyson Drugs. We have both Bob Lomanek, who's CEO and owner, been there something around 45 years, and Weston Humphrey, who's the COO, been at Tyson Drugs for 12 years. And gentlemen, welcome. Glad to have you here.
Thank you. Glad to be here.
Yeah.
Appreciate you inviting us.
So, Bob, we always start some of these podcasts with the pharmacist origin story. So you have to have a pharmacist origin story that you can tell. How did you get started in this, and how'd you get here?
Well, and he mentioned 45 years. I wish you hadn't told that. It's hard to believe that it's been 45 years.
It is.
But
Well,
I
you
started
started when
in
you were
high
8.
school. Pardon me?
You started when you were 8, right?
That's right. That's exactly right. Graduated from pharmacy school at 12. So, I grew up actually in a little town in northeast Mississippi working in a pharmacy. When I got my driver's license, like kids back then had to do, I had to go to work. And delivery guy, swept and mop every afternoon and ran the cash register, just did whatever. And a young pharmacist there got me interested in pharmacy school. And he kind of nudged me along the way, and that's what I did. I enrolled at Ole Miss and went to pharmacy school, and my goal was to own my own pharmacy. I worked probably 3-4 years for someone else, and really worked at a very high volume independent pharmacy up in the edge of Tennessee. I'm in North Mississippi, so we're just below Memphis. So there was a pharmacy in the Memphis area that was very high volume. And I really learned how to practice pharmacy in that place. And then this opportunity here in Holly Springs, Mississippi, in North Mississippi, just north of Oxford, where the Ole Miss Pharmacy School is, became available. 2 elderly gentlemen owned it, and they were wanting to bring someone in to train them and take over the business. And I came in, I don't know, early 80s. And they stayed around. One of them got out almost immediately, and the other one hung around for 8 or 9 years. And eventually took over and grew it from one location to actually now we have 4. We have a compliance packaging division. We'll call it one of my locations, and then 3 more traditional retail locations. So it's grown in the last 40 some odd years, and we've managed to. I think stay ahead of the curve, if you will.
That's awesome. One of the things you mentioned was being a delivery driver as a high school kid. I grew up in a community pharmacy, and I was a delivery driver. And I still remember going to people's houses, them paying in cash.
Oh, yeah.
Sometimes they would take me into the basement, and they would dig into their coffee cans and pull out little wads of cash and pay their prescriptions. And, it didn't really mean much to me at the time, but looking back, you're like, these are people that, lived through the Depression, that hid their money because they were afraid of, banks and all kinds of things. And we're coming all the way back to that, I think, now, where there's so many older adults in the community that need services beyond just somebody giving them an amber vial. It's compliance packaging, like you said, it's delivery. And I think that's only going to continue to ramp up as more complex patients stay in their homes. They're going to need more services from pharmacy. So I don't know if you had stories like that. I'm sure you did from delivery.
Oh, we still have those stories.
Yeah, right.
We still have those stories. We I don't know what we're very heavily in med synchronization. I mean, 85% of my volume is done through med sync, and we have to train patients on the beginning. And you're right, they still get those monthly checks. Most of them will not use a bank. Nowadays the way the government's set up, you have to have a bank account. They'll automatically deposit the funds, but the people go to the bank and take out cash, as soon as that check comes in.
Yeah.
And we have to train them to know that whatever day of the month, the 10th day of the month, we're going to be delivering your medications. It's going to be $25.50, and you need to save that money.
Yeah.
I even thought about getting little envelopes to where they could stick their money in there. So we still have to train patients, and to budget, if you will, so they can be ready to get their medications. Where in the past, to be quite honest, before we started MedSync, they might not get some of their medications that came due the end of the month because they didn't have any money.
Mm-hmm.
Yeah.
So we would train them to get all their medications at one time. And I have funny stories that, a patient would get 6 or 7 medications throughout the month and pay $2 or $3 each, which would mean they would pay 15 or 20 bucks, whatever the total was. The first time we got them synced up and told them it was $20, they said, I've never paid that much for my medication. So we had to train them to, okay, add up $2, $4, $3,
Right.
and throughout the month you are paying that much. You're just doing it one time. So we're still having to do that, Chad.
Yeah.
That's amazing. Well, Weston, you're a Ole Miss graduate also. Tell us a little bit about your story and your work at Tyson's.
Yeah, so I got hired on. Go ahead, Bob.
No, I'm sorry.
Hired on probably about 16 years old. Started scooping ice cream at Tyson Drugs. That was kind of one of the staples at the pharmacy at the time. Worked as a technician all through high school and college, and then right as the year I graduated from Ole Miss, I got a business degree. Bob had actually purchased our third location, which was in Oxford. So he offered to have me come and actually manage that location, which is where I'm at today. 7 years later. So the goal when I came into this location full time was make this pharmacy, which had been a local owner for 40 plus years. He was doing business the same way they did it back in 1969, all the way up to 2018. So the goal was come into this pharmacy, teach them how to run a pharmacy like Tyson Drugs, and let's take just as good a care of these patients as we do in Holly Springs. So I've been working with Bob ever since, and we've done a lot of new projects and new things and innovative things. And we actually have a medical clinic here at this location now that we opened about a year and a half ago.
Awesome.
So I've been managing that as well, which has been really, really interesting to get our feet in that door.
Awesome.
Before we jump in those new things, Weston, Bob, I remember you and I talked a few years back when I was VP at Parada, and I brought this up before the call, but one thing that stuck with me is this was right around 2021. So COVID had already been out, and one of the challenges that all pharmacies had was, especially retail pharmacies, was their business hurt quite a bit. But Bob and team was prepared. They were pre-prepared because they had already been delivering to home.
Yeah.
And so we were talking about how, he didn't just survive, but Tyson Drugs thrived during that time. All of a sudden his business became more popular because he already had the established routes. He's already doing long-term care at home before it was called long-term care at home.
Right.
So Bob, can you tell us a little bit about kind of that remember me about that COVID experience and kind of how you guys really, really took it to a whole nother level?
Yeah. And I apologize. There's noise, but when I'm on a busy street, it's not very well insulated. Yeah. When COVID, it caught us all by surprise, of course, but because we had an aggressive MedSync program, and as you said, we already did a lot of home delivery, and we didn't stop that home delivery. We continued that, and it grew it because we had MedSync. Patients were getting their medications one time a month, and we weren't going to their home multiple times a month. The other thing that we did because of the MedSync program is, if you'll remember, we had to close our storefronts for, 2 or 3 months. People were not allowed to come in, and I'm on a corner, and we simply knocked a hole in the front wall and made a walk-up window and created a phone number with a dedicated number that went directly to the front counter. So patients, as they pulled up, they could call that number and say, "Hey, I'm John Smith. I'm here to pick up my meds." They would walk up to the window, and it would be a quick transaction, is where I'm going with this. So we put efficiencies in place to where people could communicate with us through either phone or technology, a text message or email if they chose, and we would have their medications ready. And we would also ask them what over-the-counter items did they need. Did they need cough syrup? Did they need Tylenol? Anything else that would save them from having to go to the big boxes or go into a location where there's other people for those businesses who did not close their doors. But anyway, it made it easier for the patients, is my point. And we went above and beyond, like I said, the phone system, the window out front. And actually, one day I drove by the window out front, and there was 5 or 6 people crowded around the window. I said, well, that's not what they need to be doing. And so I went to the hardware store and bought some of that yellow tape, bright tape. And not knowing whether it would work or not, I put X's on the sidewalk about 6 feet apart. I did about 10 of them.
Yeah.
And I drove by later, and it was just like kindergarten kids. They were all standing on an X, waiting for their turn to walk up to the window. So we adapted. We just did what we had to do, to be honest with you.
Yeah. One of the most favorite things that Bob said during that time is he said, this is right about the time that Amazon bought PillPack. And he said, Amazon didn't scare me. Like, they're never going to provide this hands-on customer service that we can provide. Like, I'm not going to lose patients to companies like Amazon or mail order pharmacies. And this always kind of stuck with me.
Yeah, I think that, a common fear, pharmacy always seems to be looking for the end. Like, the sky is falling. This is it.
This is it.
Amazon buying a pharmacy. That's it. It's going to be over soon. And the reality is those things actually strengthen pharmacy because they create more opportunity for the pharmacists that are out there that are innovative and can hustle. And having somebody like Amazon Pharmacy supporting your effort to better reimbursement for pharmacy is probably a good thing. They have a lot of resources they could put into, we should get paid more for compliance packaging. Amazon would support that.
Yeah.
And at the end of the day, we win that battle. People like Bob, Tyson's, these pharmacies that go out and hustle and have good relationships with their communities are going to benefit.
Yeah.
Amazon's not going to take that away.
Well, he actually told me a story that one of his elderly patients said, I can't get out. You guys are bringing my drugs, but I really want a Big Mac. Can you bring me? I was like, Bob, you guys invented DoorDash.
Right.
Well, and as I told you, our delivery guys are not couriers that we don't know who they are. They are my guys. They're my employees, and we've got delivery little Priuses and now electric cars that they know it. They go on the same route every day, not every day the same, but they know their patients is where I'm going with this, and the patients know them. Matter of fact, during the holidays one time when we were expecting some bad weather, I actually got out and delivered some local patients to help them out because we were trying to be ahead. And that's a beautiful part about MedSync. We can work ahead and have their medications to them in advance before the weather comes in. So I was helping out, and when I would call the patients, I'd say, "Hey, this is Bob. Some of these patients I didn't know, but most of them I did. But the ones I didn't know, I'd say, "Hey, this is Bob. I'm bringing your medication," and they would say, "Something wrong with James? What's wrong with James?" So I said, "No, James is fine. He's just covered up, and I'm helping him out." So they have that personal relationship with those patients. And so sometimes they do ask them to get them a hamburger or bring the mail into them when they stop in front of the house, or bring my packages in, my Amazon packages. So, they establish that closeness, that relationship. And back to the COVID thing, one of my mottos is you never waste a good crisis.
That's right.
As Chad, as you said, everybody thinks the sky is falling, but find that silver lining in that crisis and take advantage of it. And we did that when the COVID vaccines came out. A lot of people had those long lines, and we had a little bit, but we created a appointment-based model to where people could go online and make an appointment, and we had it like a cattle run. We had them coming in there, and we had a side door that they would come in, and they were there for 15 minutes because they had to wait, but we had the paperwork ready. We were very efficient with that. When they would walk in the door, we had their injection ready. We would pop them, set them over in the corner. 15 minutes later, I think we were doing 4 or 5, 6 at a time, weren't we, Weston?
Yeah, we went from averaging 1,000 vaccines a year to doing 6,000 COVID vaccines in the first year and a half of COVID. So, and that was through MedSync and the appointment-based model that we used to do that.
That's amazing.
I was on a panel discussion about vaccines. One of my colleagues was from Pittsburgh, and one was from, Boston or somewhere, and they were talking about doing 10,000, 15,000 vaccines, and I think at the time we had done 8,000, and And so when I heard that, I said, wait a minute, let me put this in perspective. We live in a town of 4,000 people.
Right.
So
Right.
so, and they're in metropolitan areas. So it, again, being prepared, never waste a good crisis, just doing what you have to do. And it worked out really well.
Yeah, I think vaccines is a real opportunity. Obviously, community has been doing it longer than long-term care has been doing it in terms of the pharmacies, but it's something that the pharmacies should really embrace and be responsible for. They're better at it. They can track it. I can't tell you how many times I tried to tell somebody in the federal government, if you just treated the vaccine like a script, you would have all of this information that you desire to have.
Mm-hmm.
But because you let, a nursing home buy vaccine directly and administer vaccines, nothing wrong with that, but there's no traceability, there's no documentation, and we can't get our hands around who's been vaxxed with what and where they are in their process for their older adult vaccines. If you just created a mechanism where the pharmacy was at least central, you could collect all that information, be more efficient with it. So we keep pushing that at this level. ECAPS is a way of trying to push that if we can finally get that piece of legislation through. But vaccines a huge opportunity.
They really are. And I know in states like Mississippi, we have a reporting mechanism, but they don't require everyone to use it.
Right.
And that doesn't make any sense. So now when we do a vaccine, we automatically report every vaccine, but we can go on that registry and we can't tell whether anyone's had a pneumonia vaccine or unless we gave it,
Right.
and it's so,
it's polypharmacy. Yeah.
I think the pediatricians, Weston, they're the only ones that are required to report them.
Yeah, to my knowledge, in Mississippi, they report those to the state registry, but most doctors' offices that give a flu shot, they're not going to report that to the registry, and it's mostly because they don't have an automated mechanism to do that. They can manually go in and report it, but just the labor that it takes to do that, it's not a requirement. So a lot of people say, well, we just won't do it. So, but we made it a goal at Tyson's, back during COVID, it was a requirement for the COVID vaccine. And after we finally got the automated mechanism set up, we said, well, we're just going to start doing this for all vaccines so that our local providers can see, what vaccines our patients have been given. And then they can also see that they've gotten it at a Tyson drugstore. So,
yeah.
Chad, you mentioned that vaccines are a good way. We have to increase revenue because of COVID and the way we did it. We've actually become a vaccine hub in this area. Our state health department is 2 blocks from us. They're sending their patients to us for the vaccines.
Perfect. That's the way it should be. I think it's great. It's great.
Yeah.
The way it should be.
It's appointment based, and so our pharmacists are not surprised every day. When we walk in every morning, we print a report of who's coming in for what vaccine, so we're ready for them.
Yeah.
So Weston, back to innovation. I know you guys at Tyson are doing MedSync and multi-dose compliance pouch packaging and delivery. Like I said, you're basically doing long-term care at home already and leading the charge in there. But what are things you guys working on as far as innovations and new projects?
Well, like I said, we opened a medical practice. It's actually a direct primary care, so we're not billing insurance. It's all cash based, and we call ourselves a co-located clinic. So it's a pharmacy and a clinic in one building, and we're working together to take care of patients. So our patients, they actually pay a membership fee each month to be an active patient. And with that, they get unlimited visits at the clinic, as well as a free formulary of medicines at any of our pharmacies. So for $75 a month, patients are pretty much getting 90% of their health care taken care of. So this is in a world where, obviously insurance premiums are out the roof, and a lot of times insurance is not even covering, the care that you need. So we've actually found that we're giving patients a better access to care and more rounded care in that model. And then the other is we're working with a physiatrist right now out of New Jersey. And I'll kind of let Bob speak to that one, but that's got to be the most innovative thing, targeted towards the Medicare, the aging population that we've had a hand in.
You mentioned long-term care at home, and that's, you're familiar with a physiatrist? That's like a rehab physician on steroids, if you will. Yeah. So what we're doing is, obviously rehab is somebody has knee surgery or they're in a terrible accident or something, they have to go through rehab. But what we've discovered through CPSN model is, and you guys know this as well as anyone, or better than most, long-term care, as people start aging, people retire, they're less mobile. About the only exercise they get is that remote control on the TV,
Right.
and so their muscles start wasting away and they get frail. That's when they start falling. And people don't want to be in nursing homes. They want to be at home.
No.
So the more we can do for them at home, the better. So what we're doing with this physiatrist is we're partnering with him, and we're working with the elderly patients. They will come in actually to our store, or we can do it at their location through telehealth. They will do a visit with this physiatrist, and he will ask, we'll give him some background information, but he will ask them a series of questions. And what he does is he assigns them some exercises to do at home, whether it be standing up, sitting in a chair and standing up multiple times, or push-ups against the wall, or various things. We're not running marathons, we're not going to the gym doing big weightlifting, but it's stuff keeping them active, keeping those muscles moving. And we'll give them an app. Even the elderly now, every one of them have a cell phone. Well, we give them an app. We install it on their app, and they simply, before they do their exercises, they mash a button that says start, and we get a signal that, hey, they're doing their exercise. Well, now they could get up, mash that button, and go back to bed. But this is the message. This is the accountability piece. So if we don't get that message, say 3 or 4 days in a row, we're calling Miss Johnson and saying, why aren't you doing your exercises? We hold them accountable then, and we report that back to the physiatrist, and we collaborate with them. So it's really a program that the patients are really just jumping all over. We've just really kicked it off. I guess January is when we really started rolling patients into it pretty heavily. So that's awesome. Pretty innovative, and I think really cool for these elderly patients.
Awesome.
Yeah.
Really innovative.
That falls in line with, remote patient monitoring and being able to put, so absolutely. And that's opportunity exactly for reimbursement through the physician, the prescriber.
So, if you look at community pharmacy and you listen to what we hear in the Beltway of DC and some of the rhetoric, pharmacies are closing, independent pharmacies are closing, everything's bad. It's the sky's falling again. And there are some legitimate threats to the reimbursement model that pharmacy has, and we have to fight those. But from your perspective, you've been doing this 45 years. How do you look at pharmacy? You've got a daughter that's going to be a pharmacist in another year. Weston is a new employee, running the business, helping run the business. Where do you see pharmacy going in the future?
Well, for a while, there was an evolution going on because of reimbursement to fill as many prescriptions as quickly as you can, get the patient out the door, get the next one in. Volume. Well, if you're doing dispensing only, that's a race to the bottom.
Yep.
So pharmacy schools across the nation they're not teaching students how to count by fives faster. They're teaching them how to take care of patients. If we, the older generation, if we don't give the pharmacists a playing field to practice in, then we're all going to sink. So that's why we're getting into these clinical services. That's what MedSync brings to the table. It allows you to have time to do this DSME. We hadn't even touched on that. We're doing diabetic education. We're doing this PPC model, this physiatrist-pharmacist collaboration. We're doing MedSync. We're doing compliance packaging. We're following adherence. We're making certain that the patients are taking their medications, taking the right medications, and we're also following up to make certain that they're getting the proper outcomes from those medications. Now, the problem is there a payment model for this? Yeah, people don't realize it, but a lot of states are passing provider status to where pharmacists can get paid for putting a continuous glucose monitor on a patient. So many pharmacies are doing that right now for free. We should be getting paid so we can collaborate with physicians, those of us who do not have provider status, collaborate physicians, let them bill for that service that we're doing, and then do a revenue split. So there's ways of getting revenue on stuff that we're doing for those patients. MedSync. We could actually do maybe an RPM call for MedSync and do some billing on that and get some bucks. That's what we're looking into. We're constantly looking at ways to get revenue outside of dispensing. Now, you still got to do the dispensing. That's what engages the patient. And we're still going to fight that battle, and we should.
Yep.
So, and I don't know what yesterday's announcement, our president what's going to happen there. But this is I think the other evolution that's happening now. We've got to get away from just thinking we can continue to commoditize the practice of pharmacy. We've got to take care of patients and collaborate with prescribers.
Yeah, and I think, a lot of not just the president's announcement, but the whole Inflation Reduction Act, the PBMs themselves have put so much pressure on that price that it's creating these other opportunities. It's almost, all of us want cheaper medications. I mean, nobody wants to be on $1,000 medication that, a month. But the reality is that our reimbursement should not be tied to you being on a more expensive med or us filling more expensive meds. It should be tied on that care that we're giving and the quality of the health care that person's receiving. And this price pressure on drugs is kind of pushing us that way. Because it has to. They're not going to do something where all the pharmacies close. I mean, that's not realistic. There would be too much collateral damage from that. So they're going to have to create more ways for pharmacies to get reimbursement outside of pricing if they're going to make that the thing that they go after. So it's not easy. To your point, a lot of people aren't aware of some of these things. And so when I see pharmacies close, my first reaction isn't, well, that's because our system is broken and we have to fix reimbursement. That's one of the things I think about. The other thing I think about is that a pharmacist that's just tired and has worked and retired and just is giving up because they don't want to fight hard and find these new things? Or is it a pharmacy that's hustling and doing what they need to be doing and trying to find ways to survive? I don't think it's that pharmacy. I think it's the pharmacy that's kind of stuck in their old ways and like, well,
sure,
I'm too tired to change, so I'm just going to get out. And that's okay. They've earned that right, depending, on their practice. But I have to believe there are pharmacies like yours that are out there just innovating at every turn to figure out how to make the business work, and it's working. And you're surviving, and you're succeeding.
The gentleman that a real good friend of mine that I acquired the store for in Oxford. He was just a prince of a guy, but he was doing business the same way that he had done for, as Weston said, for 40 something years, never really changed. And so a couple of weeks after I took over, maybe a month, I talked with him and he said, "How's it going?" I said, "Well, I made some changes, and some people are, a little irritated." And he said something that I've used and it is exactly right on target. Even though he didn't live by it, he says, nobody wants change, but everyone wants progress. And you can't have one without the other.
That's right.
Yeah.
Yeah. So I embrace change, to be honest with you now. And Weston knows and my staff knows we try a lot of different things. And if some of them don't work, I'll be honest, and that's okay. It doesn't upset me. But if we don't try them, we don't know. And if you're not trying anything, you're not progressing. You're not. You can't just sit back. If the old saying, if you continue to do what you've always done, you'll get what you always got.
That's right.
Yeah. So that's not my motto.
That's amazing.
So Weston, I see that you're going to be speaking, as Chad and I both are as well, at Red Sail Connect. What are you going to be talking about?
Yeah, so Chelsea, my coworker that's not on the call today, but she has just as important of a role as I have at Tyson's. She's going to be with us on the stage, as well as Tiffany Capps, who's out of North Carolina, works for CPSN. Us three, we're all technician background, operations, managers, is all of our experiences. And we have a vast experience in MedSync and teaching technicians how to run a MedSync program and improving MedSync models, specifically within the Pioneer software. So for the past 2 years now, I think Pioneer's asked us to come and talk about MedSync and talk about how to maximize Pioneer's features to make MedSync work well in your pharmacy. So we, at Tyson Drugs, along with a lot of other pharmacies that I've talked to out there, we feel like we've mastered MedSync using Pioneer. So we're just going to be sharing some of the things and tips and tricks that we've learned on how to really maximize it. So,
awesome.
Yeah, what was interesting with that is I don't know where you know, but I'm affectionately known as a godfather of MedSync throughout the country, and I've done hundreds of presentations, mainly to store owners, about MedSync. And one of the biggest complaints I would get was, I'm doing all I can do right now. I can't do any more. So several years ago, there was a focus on getting technicians. You're trying to use them at the top of their license.
Mm-hmm.
I love my technicians and I really utilize them, but so many store owners don't let technicians do as much as they can and want to do. So there was a movement within the industry with all the wholesale meetings during the summer's conventions to talk about utilizing technicians more. So Weston, Chelsea, they were asked to speak at some of these wholesale meetings, and Tiffany, and it was overwhelmingly receptive. The rooms were just full. So I had already been asked, this was 3 years ago, to speak at NCPA on MedSync. So that summer that rolled through, they were so popular, and they just would fill the rooms up with not just owners, but with technicians who could take the MedSync model and incorporate it into the store. And the pharmacist didn't have to do all that. The pharmacy owner didn't have to do all of that.
Awesome.
Well, NCPA reached out to me after I'd already committed to speak, and they said, well, we don't quite know how to do this, but we really had rather have Chelsea and Weston and Tiffany than you.
You're old news, Bob.
I will pass the baton. I'm happy to do that. So now they're in demand to speak on MedSync, which is awesome. It's the way it should be.
No, that's amazing. Yes, that is the way it should be. It's a career technician's work, and be able to kind of get them outside the counter themselves and to be able to help in all these different ways. So once again, very trailblazing and innovative of you.
Well, we underutilize the technicians. They want to do more. You may not think they do, but they want more. They want responsibility. And I give it to them, and they're so appreciative. I let them take projects on and run it. And delegating was one of the smartest things I ever learned in my career.
I bet. This has been awesome.
This has been great. I have one more line of questions. I met Bob at the Grove in Oxford, Mississippi, before a Ole Miss football game. I got the honor to speak to the students at Ole Miss, and I guess my question is, Bob, what does it look like next year for the Ole Miss football team?
Well, the Lane Kiffin, you never know.
That's right.
The roster will look completely different as it does every year, but the guy's amazing. I think, last year we were so close, close. And he, I listen to sports talk every day, and they were talking last night that, you guys never stop recruiting. It's just you're just always recruiting. And every day we hear about some new player we've got. So I think it looks exciting. I've had season tickets for years, and I almost every year I almost say, well, I'm just not going to do it. My best screen is in my living room, but I'm 20 minutes away. And at the last minute, I said, nope, I'm getting my tickets back. I can't stand it. So I think the future is bright for Ole Miss football, to answer your question.
There you go. Hotty toddy.
Hotty toddy. Thank you. You learned a little something.
I learned a little. And I'll tell you what, I'd go to the game. The Grove is just a bucket list. You got to go to the Grove at some point and see a football game. It's amazing down there. Well, thanks for being on, guys. I appreciate it. You guys are out there leading the way, and our members appreciate hearing these stories that are positive and just examples of what success can look like if you hustle, if you figure things out.
Yeah, and it's something unique about our industry, I think, versus other industries is there's that entrepreneur spirit is alive and well. And you're a prime example of that, Bob and Weston, and I appreciate you kind of leading that charge over the last several years, but looks like you're not done. So we're looking forward to what's coming.
And I will tell you guys that I don't know what you can tell by my personality. I'm enjoying what I'm doing. I'm at the point where I need to be put out to pasture. But I'm enjoying what I'm doing because of great people like Weston and Chelsea, and share my leadership team and my staff. That with them we've created a great atmosphere and a workflow that's very manageable, and people are happy at work. And so, let's just keep going.
It's all
So,
good. Yeah. Thanks so much.
Yeah. Well, join us next time for our Experience podcast.
Thanks, guys.
Thank y'all for having us.